My question is addressed to the Prime Minister. In March, the Prime Minister said the government had been working on personal protective equipment for months. Last month, the Aged Care Royal Commission said the shortage of PPE in aged care was, to quote them, deplorable. Can the Prime Minister confirm that between March and August this year, his government received 2,865 PPE requests from aged care providers, but rejected over half of them, leaving residents and frontline workers more vulnerable as a result?
The Prime Minister.
Mr Speaker, the Minister for Health can update the House on those matters.
The Minister for Health.
Thank you very much, Mr Speaker, and I'm very happy to answer this on behalf of the government. The advice that I have is that, of course, the government during the course of this year has acquired over 500 million masks in what has been a global shortage. At a time of extreme global shortage and a spike in demand, we've been able to maintain that air bridge for the nation as well as engage in domestic production. In particular, that has seen already 78 million masks have been dispatched from the National Medical Stockpile, according to the rules of the National Medical Stockpile. With regards specifically to aged care, the National Medical Stockpile has provided aged care facilities with approximately 18 million masks, 5 million gowns, 11 million gloves, 4 million goggles and face shields, 90,000 bottles of hand sanitisers and 160,000 clinical waste bags. The time frame that I have is that between the 18th of February 2020 and the 20th of October 2020, the Department of Health received requests and responded to 1,769 requests for PPE with dispatches, and very significantly, all requests from providers managing a COVID outbreak were approved. In addition to that, all requests for assistance outside of outbreaks, where aged care providers could not source PPE to meet a clinical need, that is, to manage some form of outbreak or similar item, were met. So 100% of the complying requests were met, according to the terms of the National Medical Stockpile, and there are no cases that we are aware of where any complying request was not met, and we did this on the basis of the medical advice, and we did this on the basis of the advice of the AHPPC, the medical expert panel which has guided Australia through this. So the provision of personal protective equipment has been one of the most significant and important achievements of this government. We have seen the outbreaks. We have seen the collapse across Italy and Spain and France. We've seen the shortages in New York and the United Kingdom in relation to PPE. And against that background, these provisions have been consistent. They have been done on the basis of rules set by the medical experts, and we have met all of those requests which met those requirements.